Some of them have expressed being overwhelmed to the point where they're crying before they go to work.
The pressure of keeping COVID-19 patients alive, frontline worker fatigue becoming overwhelming in some hospitals. While many look at lower case numbers to justify relaxing restrictions, healthcare professionals say pandemic pressure hasn't let off.
There's huge pressures to take care of these very sick patients with a super high caseload. So a lot of stress, a lot of pressure. I've heard stories of nurses crying while they're on shift or, when they go home.
Simple tasks like checking on a patient are complicated with added safety protocol. Whether they're COVID-19 or other patients, nurses put on full PPE just to enter a room. This waste showing the piles of gowns they tear off before leaving. The United Nurses of Alberta says members working on outbreak units have cycles of being short-staffed and working long overtime hours if workers themselves are in quarantine or sick.
Hospitalization rates are a lagging indicator, and on average, patients admitted due to COVID-19 have an average stay of 12 days. This can be even longer for the sickest patients who need ICU care. Until our hospitalization rates come down like our other numbers, we need to continue with the measures in place.
The UNA says nurses are still excited about going through the province's vaccination program, the glimmer of hope as the province approaches 1 year since its first COVID-19 case. But new challenges are emerging, and some feel a lower number of active cases may not be enough.
We'll have to see what happens with the numbers this week and what's happening, but we certainly have some concerns, in particular with variants coming into the province and what that's going to mean and what that means for how aggressive the measures should be.
In Calgary, Crystal Ladaris, City News.